Welcome to Pediatric Case Review. Today we'll explore Holt Oram syndrome, an autosomal dominant disorder characterized by upper limb abnormalities and congenital heart defects. This introductory lecture will provide clinicians with essential knowledge for recognition and management of this condition. Let's begin with our first case. A 2-day-old newborn presents with bilateral upper limb abnormalities and a heart murmur. Family history reveals the father has similar arm deformities. Which genetic syndrome should you suspect? A. DeGeorge syndrome. B. Holt Oram syndrome. C. Williams syndrome. D. Noonan syndrome. The correct answer is B. Holt Oram syndrome. This condition follows an autosomal dominant inheritance pattern, explaining the father's similar presentation. The combination of upper limb abnormalities and cardiac defects is the hallmark presentation of Holt Oram syndrome, which is caused by mutations in the TBX5 gene. Which cardiac defect is most commonly associated with Holt Oram syndrome? A. Patent ductus arteriosus. B. Ventricular septal defect. C. Tetralogy of Fallot. D. Coarctation of aorta. The correct answer is B. Ventricular septal defect. Approximately 75% of Holt Oram patients with cardiac manifestations present with ventricular septal defects. Atrial septal defects are the second most common cardiac abnormality. Patients may also develop conduction abnormalities even in the absence of structural defects. A 5-year-old with Holt Oram syndrome most likely presents with which of these symptoms? A. Lower limb paralysis. B. Thumb abnormalities. C. Facial dysmorphism. D. Neurological impairment. The correct answer is B. Thumb abnormalities. Upper limb defects, particularly of the thumbs and radial bones, are cardinal features of Holt Oram syndrome. These range from triphalangeal or hypoplastic thumbs to more severe abnormalities like phocomelia. Lower limb involvement is not characteristic, and neurological and facial features are typically normal. During physical examination of a patient with suspected Holt Oram syndrome, which of these findings would be most supportive of the diagnosis? A. Bilateral clinodactyly. B. Sloping shoulders. C. Triphalangeal thumbs. D. Syndactyly of toes. The correct answer is C. Triphalangeal thumbs. This refers to thumbs with 3 phalanges instead of the normal 2, creating a finger-like appearance. This is one of the most characteristic upper limb abnormalities seen in Holt Oram syndrome, along with hypoplasia, aplasia, or displacement of the thumb. Lower limb abnormalities are not typically seen. On cardiac examination of a 2-month-old with suspected Holt Oram syndrome, which finding would you most likely detect? A. Continuous machinery murmur. B. Pansystolic murmur at left sternal border. C. Wide fixed splitting of S2. D. Diastolic rumble. The correct answer is B. Pansystolic murmur at left sternal border. This finding is consistent with a ventricular septal defect, which is the most common cardiac defect in Holt Oram syndrome. The murmur is typically heard best at the left lower sternal border and may be accompanied by a thrill. VSD is found in approximately 75% of patients with cardiac involvement. A 12-year-old with Holt Oram syndrome presents for evaluation. Which skeletal finding would be most consistent with this diagnosis? A. Asymmetric upper limbs. B. Shortened lower extremities. C. Craniosynostosis. D. Lumbar scoliosis. The correct answer is A. Asymmetric upper limbs. While Holt Oram syndrome typically affects both upper limbs, the severity can be asymmetric, with one side more affected than the other. Common findings include abnormal carpal bones, radius hypoplasia or aplasia, and various thumb abnormalities. Lower limb involvement is not characteristic of this syndrome. Which gene mutation is responsible for Holt Oram syndrome? A. PTPN11 gene. B. TBX5 gene. C. FBN1 gene. D. FGFR3 gene. The correct answer is B. TBX5 gene. Mutations in this gene, located on chromosome 12q24.1, are responsible for Holt Oram syndrome. TBX5 encodes a transcription factor that is crucial for proper development of both the heart and upper limbs during embryonic development. Over 100 different mutations have been identified. What is the inheritance pattern of Holt Oram syndrome? A. X-linked recessive. B. Autosomal recessive. C. Autosomal dominant. D. Mitochondrial. The correct answer is C. Autosomal dominant. Holt Oram syndrome follows an autosomal dominant inheritance pattern, meaning a single copy of the mutated gene is sufficient to cause the disorder. Approximately 85% of cases have a positive family history, while 15% arise from new mutations. The syndrome shows variable expressivity, even within families. A newborn with upper limb abnormalities is being evaluated for possible Holt Oram syndrome. Which initial imaging study would be most appropriate? A. MRI of the upper limbs. B. X-ray of the upper limbs. C. CT scan of the heart. D. Bone density scan. The correct answer is B. X-ray of the upper limbs. This is the most appropriate initial imaging study to document the skeletal abnormalities characteristic of Holt Oram syndrome. X-rays can demonstrate thumb hypoplasia, triphalangeal thumbs, carpal bone abnormalities, and radial dysplasia. These findings help establish the diagnosis and assess the severity of skeletal involvement. Which cardiac investigation is essential in the initial evaluation of all patients with suspected Holt Oram syndrome? A. Electrocardiogram. B. Cardiac MRI. C. Cardiac catheterization. D. Exercise stress test. The correct answer is A. Electrocardiogram. An ECG is essential in evaluating all patients with suspected Holt Oram syndrome, even those without apparent heart defects. This is because conduction abnormalities can occur independently of structural cardiac defects. Common findings include first-degree AV block, bundle branch blocks, or more severe conduction disturbances requiring intervention. A child with confirmed Holt Oram syndrome requires cardiac evaluation. Which test best assesses for structural cardiac defects? A. Transesophageal echocardiography. B. Chest X-ray. C. Transthoracic echocardiography. D. Cardiac CT scan. The correct answer is C. Transthoracic echocardiography. This non-invasive imaging modality is the gold standard for evaluating structural heart defects in patients with Holt Oram syndrome. It can identify atrial and ventricular septal defects, assess cardiac function, and provide information on chamber sizes and valve function. It's well tolerated by children and provides comprehensive cardiac assessment. A 6-month-old with Holt Oram syndrome has a large VSD causing heart failure symptoms. What is the most appropriate management? A. Medical management only. B. Surgical VSD closure. C. Cardiac transplantation. D. Balloon septostomy. The correct answer is B. Surgical VSD closure. For large ventricular septal defects causing heart failure symptoms, surgical closure is the definitive treatment. While medical management with diuretics and ACE inhibitors may be used initially to control symptoms, surgical intervention is necessary to prevent progressive heart failure and pulmonary hypertension. The timing of surgery depends on clinical symptoms and VSD size. A newborn with Holt Oram syndrome has significant thumb hypoplasia. When should surgical intervention be considered? A. Immediately after birth. B. Between 6 to 18 months. C. After 5 years of age. D. Only if functionally necessary in adulthood. The correct answer is B. Between 6 to 18 months. This time frame is considered optimal for thumb reconstruction procedures. Early intervention allows for better functional adaptation and utilization of the reconstructed thumb during critical developmental periods. Surgical options depend on the severity and may include pollicization, where the index finger is rotated to create a functional thumb position. A 25-year-old with Holt Oram syndrome and normal echocardiography develops intermittent palpitations. What management step is most appropriate? A. Reassurance only. B. 24-hour Holter monitoring. C. Electrophysiologist study. D. Prophylactic pacemaker implantation. The correct answer is B. 24-hour Holter monitoring. Patients with Holt Oram syndrome can develop conduction abnormalities even with structurally normal hearts. Holter monitoring is the appropriate initial investigation for a patient with palpitations, as it may detect intermittent arrhythmias or conduction defects that could be missed on a standard ECG. Further management depends on the findings. Which long-term complication may develop in adult patients with Holt Oram syndrome who have unrepaired cardiac defects? A. Pulmonary hypertension. B. Kidney failure. C. Liver cirrhosis. D. Retinal detachment. The correct answer is A. Pulmonary hypertension. This is a significant complication that can develop in patients with unrepaired cardiac defects, particularly atrial and ventricular septal defects. Chronic left-to-right shunting leads to increased pulmonary blood flow and pressure, eventually causing irreversible pulmonary vascular changes. This underscores the importance of early cardiac evaluation and timely intervention. A 35-year-old with Holt Oram syndrome is considering pregnancy. Which concern is most relevant to discuss during preconception counseling? A. Risk of transmitting the condition. B. Contraindication to vaginal delivery. C. Need for therapeutic abortion. D. Incompatibility with breastfeeding. The correct answer is A. Risk of transmitting the condition. Due to the autosomal dominant inheritance pattern, an affected individual has a 50% chance of passing the condition to each child. Genetic counseling should be offered to discuss this risk, along with options such as pre-implantation genetic diagnosis. Additionally, cardiac status should be evaluated, as pregnancy can stress an already compromised heart. Which condition is not associated with Holt Oram syndrome? A. Hard-hand syndrome type 2. B. Duane syndrome. C. Tabachnik syndrome. D. Okihiro syndrome. The correct answer is B. Duane syndrome. This is a distinct condition characterized by limited eye abduction and is not associated with Holt Oram syndrome. The other options represent phenotypically similar conditions. Hard-hand syndrome type 2, Tabachnik syndrome, and Okihiro syndrome all feature upper limb and cardiac abnormalities that may resemble Holt Oram, but have different genetic causes. Thank you for joining us to learn about Holt Oram syndrome. Remember the key features: upper limb abnormalities, particularly of the thumbs, cardiac defects, especially VSDs, and autosomal dominant inheritance. Early recognition leads to better outcomes through timely cardiac and orthopedic interventions. Please follow our Pediatric Case Review channel for more informative presentations. If you have questions, please leave them in the comments section below. Thank you for watching.